If you're watching this video, you probably had a heart attack. In this video, we're going to cover the basics of heart attack recovery, so you can have a better idea of what to expect after you have been discharged from the hospital. Let's start with the basics of what a heart attack is. There are many types, but in general, a heart attack occurs when the muscles in your heart don't get enough blood flow due to a clot, and the cells start to die. Once blood flow is restored, the heart can begin to recover and new muscle cells can begin to grow. There are many ways blood flow may have been restored to your heart. Surgical options might have included angioplasty, where a small balloon is fed to the blocked blood vessel by a wire and is inflated. Or a stent may have been used, where a wire mesh tube is placed on the balloon catheter and expanded into place to keep the blood vessels open for a longer period of time. It's also possible that you had a coronary bypass surgery, which involves taking blood vessels from elsewhere in the body and attaching them to the heart's blood vessels, using them to redirect blood flow around the blockage. Medications alone might have also been enough to remove the clot without any surgery at all. Most people can go home after 3 to 5 days in hospital, but in some cases, the stay in hospital could be longer. When it's time to go home, you can expect to be sent with several new prescriptions. These can include drugs like aspirin and antiplatelet drugs like clopidogrel and ticagrelor, which are used to prevent blood clots from occurring inside the arteries that feed the heart. Beta blockers like metoprolol, which can be used to slow your heart rate and protect the heart from stress and future heart attacks. Nitrates, including nitroglycerin patches, pills, or sprays, which are medications that dilate coronary blood vessels, bringing more blood to the heart and reducing chest pain. ACE inhibitors like lisinopril, that can lower blood pressure and improve heart function. And statins like atorvastatin, which helps lower bad cholesterol levels and can help to reduce or stabilize fatty deposits inside arteries that can cause heart attacks. Medications after a heart attack are important and must be taken correctly. To help you do this, you could make a list of drugs that you take and the times you need to take them. Learn the color and shape of your medications. If you have a hard time remembering to take medications several times a day, talk to your healthcare provider about possible ways to reduce the number of times you have to take them. Finally, it's important to never stop taking prescribed drugs without first checking with your doctor. Exercise is a very important part of cardiac rehabilitation to work your heart muscle back to health and improve your lifestyle in order to prevent future heart attacks or complications. During the first few weeks following your heart attack, you'll be very limited to extremely light activities such as dressing yourself and showering. When you can start moderate intensity aerobic exercise depends on the severity of your heart attack and the interventions used, so this is an important question for your healthcare team. When given the all clear to start, a workout plan suggested by the Heart and Stroke Foundation looks something like this. Keeping in mind the acronym FIT, which stands for frequency, intensity, time, and type. You will notice that the frequency and time gradually increase. With regards to intensity, this should all be done at a moderate intensity, which means you should be able to talk comfortably the entire time. Ideally, this exercise is done as part of a supervised cardiac rehab program, but it is possible to follow a program like this at home. A 5-minute warm-up and cool-down are also very important to ensure your heart rate increases and decreases gradually. At any point, if you feel any of the following, you need to stop exercising right away. Pain, pressure, or heaviness in your chest, cold and clammy, nauseated or sick to your stomach, dizzy or lightheaded, or an overwhelming or unusual sense of fatigue or weakness. What about resistance exercise? Again, depending on the procedure you underwent, it could take up to 12 weeks for resistance exercise to be safe. It is important to consider the acronym FIT. Resistance exercise can be done 2 to 3 times per week at moderate intensity, which in this case means using a resistance or weight where you feel you could still easily complete 3 or more repetitions at the end of each set. You must start with low resistance, using body weight for exercises like squats or glute bridges, and using exercise bands for bicep curls. There are also some dietary changes that may be necessary in order to prevent further complications after your heart attack. Start by decreasing your portion size by using smaller plates, or by eating at a slower pace, as this can increase cardiac cell healing post-heart attack. When it comes to choosing what foods to eat, try to avoid foods high in saturated and trans fats, since these foods can increase cholesterol and elevate your risk of another heart attack. When cooking, instead of frying food in butter and palm oil, choose plant-based oils and roast or bake your food rather than fry it. Instead of eating red meat with every meal, try to have 2 meals a week that are fish-based and 2 that are legume-based. You should also try to avoid foods high in sodium. Salt holds fluid in your body, so decreasing your salt intake will help to decrease your blood pressure. Each day, we are only supposed to have 4 grams of salt, which is less than 1 teaspoon. When shopping, look for foods that have no salt added or low sodium labels, and avoid salted snacks, typically high sodium foods like prepared soups. Instead, increase your intake of fruits, vegetables, and whole grains. We know that these changes may be hard to implement right away, so try to get an accountability partner. Make these changes something you do with your whole family so that they can support you, and consider recording what you eat in a food diary or on a food recording app. One aspect of treatment that may not be obvious are the emotional and relational consequences. It's normal for people who have experienced a heart attack to develop depression or anxiety, and it can impact your recovery. 16% of patients experience symptoms of depression after a heart attack. Symptoms you may have if you are experiencing depression include more or less sleep than before, a lack of energy, poor concentration, agitation, reduced self-esteem, suicidal ideas or plans, loss of appetite or eating. Symptoms you may have if you are experiencing anxiety include prolonged periods of excess worry and tension, autonomic arousal, which may look like sweating, dizziness, shortness of breath, insomnia, restlessness and muscle aches, tremor or shaking, and avoidance behavior. If you are experiencing multiple symptoms, don't be afraid to reach out. Depression and anxiety can be treated through medication and with the help of a professional. Ask your doctor for a referral if this is something you or your loved ones notice you are experiencing. There are also support groups made of other heart attack survivors who can understand what you're going through. You can learn more about these groups or sign up through the Heart and Stroke Foundation of Canada. This video is meant to be a tool for you to use on your road to recovery from your heart attack. If you have any questions after watching this video about your specific condition or about heart attack recovery in general, be sure to ask your healthcare provider.